And I'd like to introduce Jon Sloper, who will be hosting the second session of the day. Thank you very much.
Welcome back. This is the part of the day which is about the how. So some introductions to ideas about how people make health and culture come alive. My name's Jon Sloper. It's an absolute privilege to be here and standing at the front and looking at so many people who changed the world for so many of us in Dorset. Your work is absolutely amazing and always humbling whenever I get a chance to kind of spend time with you and get to know what you do. I've been asked to say a few things just to kind of set context here. If I might have the slide. Just 5 short things just to bring to your attention. Things that hopefully change the how and support the how in Dorset. So for those of you that aren't yet aware, we have something called a Voluntary Community Sector Assembly for Dorset, which is in the process of growing and developing. It is an opportunity for everybody who's involved in anything in the community in Dorset to have a space and a place to talk about the things you do and to bring that work and that enthusiasm, those ideas and worries together, and for us to work through it as a group in all sorts of different ways. It's also our vehicle, our system vehicle for getting our voice heard with our integrated care system, which you've heard about already. So we have representatives from the Assembly sitting on our integrated care board, integrated partnership, and all the other acronyms. That's something that we're developing in order to give the voluntary community sector in Dorset an earlier sight of things that are happening and worrying, to give you a bigger voice in the decision making, and also to improve the partnership working that we can do together across Dorset around these different themes. Secondly, at the moment, we have quite a bit of breaking with tradition. We've talked about resources, everybody talks about money a lot, but there's also time, there's space, there's place, there's all sorts of other things. There's creativity in the things that we think about, the ways that we approach things. Those are resources too. And at the moment, those resources are more precious than ever. Money is short. We all know that. Everybody's feeling the pinch, personally, organisationally. But it isn't the only thing. It's part of the thing. And if we can be more thoughtful and more creative together in the way that we look at resources, we can sometimes do a lot more than we think. And that conversation about resources is key at the moment. What's important for all of us? How can we use scarce resources more clearly, more transparently, and engage more people so that we can do even better things together? That can involve creativity. Quite often, the VCS is seen as a net recipient from our public sector organisations. That isn't the only story here. We have access to funding, we have access to resources that the public sector can't get hands on, can't access. And we can bring some of those things to the table as well. So when we're talking about how, we're in a much more equal playing field. We're in a much more equal relationship than we ever have been before. And that brings about creativity and opportunity as well. Outcomes-based commissioning. Some of you might have heard about this. So when we're talking about working with health colleagues or with local authority partners, we're not talking about outputs, we're not talking about bums on seats, number of sessions running things in a particular way which is set within a contract or set within an agreement at the start. There's much more flexibility at this point in time, looking at what those outcomes could be. Loneliness was mentioned earlier on. How can we cope with living with loneliness? That's going to be different for everybody. The outcome would be the same, which is not feeling lonely, being less isolated. But how we do that, that's going to be different for everybody. I might go to a bowls club, might join the local skittle group, might take part in some dance or some music. I might be on an online discussion, might be in a gaming group, all sorts of different things, but the outcome is less loneliness. That changes everything in terms of how inclusive we can be in terms of resource sharing and commissioning. All roads lead to Rome. Variation and context is also really key at this point. There's a real understanding that diversity is key. If we're going to be resilient, if we're going to have long lives, we need to do different things at different times. We're going to need to lean on people, lean on our communities, work with our communities and support one another in different ways at different times. The organisations that provide services that will develop, I think, at this point, in the most interesting ways are those that stay close to the communities, that stay close to the people that we work with and that we live alongside. That diversity is important because it opens up spaces where we can tackle things that are traditionally wicked issues, the health inequalities that Paul's talked about. How do we deal with poverty in our communities? How do we deal with marginalisation and loneliness? We need a whole raft of different things to do that. We need diversity. And we also need personalisation. So the idea that what is good for one person won't necessarily be good for another person, that's key. And we as a sector, voluntary community sector, live and breathe this. This is our natural environment. This is something we're great at, being alongside the people that we live with. And finally, just wanted to mention agility and creativity. It's needed more than ever. With difficult times, we have to think different thoughts. We have to be looking at alternative solutions. We have to think about different ways of achieving the same outcomes. We have to be creative in every sense. And we need to be agile. Some of the things that we're facing pop up overnight. Some of them vanish overnight. Some of them last a long time. Some of them, it's a stepping stone. And I think, again, as a sector, the voluntary community sector is amazing at stepping into the gap, meeting the need, and then stepping quietly away. It's a beautiful thing, that lifespan. And that's, again, what we need now when we're trying to navigate change, when we're trying to make a difference, when we're trying to see how we work better with our partners in the public sector, in health, and with local authority. They're moving. They're changing. You've seen some of the ambitions that have been presented for health, and also you'll know quite a lot about the public sector. We're going to hear from families, or from the Family Pathfinder shortly. You'll hear some of their ambitions. They're not going to get there in one step. We're not going to get there in one step. We need to be taking lots of steps, sometimes big ones, sometimes small ones. And sometimes we need to be there to lead as well as follow. And we've never had the opportunities in the way we do now to take that role and to be leaders in this space as well as facilitators and followers. And that creativity that we bring to our practice is something that I think we need to bring to the way we choose to work and collaborate together. And from Dorset's point of view, the Assembly, the Voluntary Community Assembly, is here and will be here to facilitate some of that work and to be a point of dialogue and integration with our other sector partners. So without further ado, I'm going to introduce you to some people who are doing the work. I'm going to start with Pippa Jones, who is from Create Gloucestershire. Forgive me, I'll just read from my notes. So she's going to be talking to us about how she and her organisation are making it work, looking at the systems of working that have supported creative health within Gloucestershire, what they've done to make this happen and put down roots for this way of working within creative health.